Hair loss can be an upsetting experience. In a matter of weeks to months, a person can go from having a head full of luscious locks to a brush full of fallen strands. A certain amount of hair shedding is normal. We lose an average of 50 to 100 strands of hair each day, according to the American Academy of Dermatology. But when is it considered abnormal? And what are some reasons for increased rates of hair loss? Before diving into these questions, it's important to understand the hair cycle. Hair grows in 4 stages: anagen, when hair is actively growing; catagen, right before hair growth stops; telogen, when hair stops growing; and exogen, when hair sheds from the follicle. The anagen phase can last anywhere from 2 to 8 years, catagen for a brief 2 weeks, and telogen for about 3 months before the strand sheds. In an average person's lifetime, each hair follicle will undergo this cycle 10 to 30 times. As a person ages, the anagen or growth phase becomes shorter, and fewer hair follicles stay in the anagen phase. Moreover, not all shedding is true hair loss. A lot of times, hair loss is really hair breakage. Dr. Lynn McKinley Grant has said, an associate professor of dermatology at Howard University College of Medicine. Breakage can happen from brushing hair too much or using hairstyles that pull on the scalp, like weaves and tight braids. It can also happen from using harsh products or certain styling routines, McKinley Grant said. But shedding more hair than what grows back can be a sign of alopecia, the medical term for hair loss. There are many different types, ranging from hormone-induced hair loss to autoimmune disorders. The list of potential causes is enormous: diet, extreme physical or emotional stress, hormonal changes, autoimmune disorders, certain medications, and scalp health can all affect the amount and type of hair loss. Often, more than one of these factors are at play. In a type of alopecia called telogen effluvium, some hair very suddenly sheds across the entire scalp. Major surgeries, bad cases of the flu or COVID-19, chemotherapy, diabetes, anemia, thyroid disorders, hormone fluctuations, and a slew of other health conditions can trigger this type of hair loss. Hormonal changes during pregnancy can pause the shedding phase but then trigger telogen effluvium during the postpartum period. There are plenty of products marketed on social media for hair growth, but it's important to talk to a doctor first. Oftentimes, those brands tout results based on faulty methods.